Dr. Lin. Some people call me Dr. Cici, and I specialize in pelvic rehabilitation. In this video, I will walk you through what pelvic rehabilitation is and how it can help improve your daily life. My goal is to make this information simple, clear, and reassuring for you. Pelvic rehabilitation is more than just exercises. It's about restoring the way your whole pelvic system works. We'll look at how it supports bladder, bowel, reproductive, and sexual health. In this video, I will also explain why pelvic floor muscle assessment is so important and show you some common applications in real life. Before we talk about pelvic rehabilitation, it is important to understand where the pelvic floor muscles are. In the front of the pelvic floor muscles, there is pubic bone, and in the back, there is tailbone. These muscles sit like a hammock at the bottom of your pelvis, supporting your organs. Knowing the anatomy helps us see why pelvic floor function matters for your whole body. What is pelvic rehabilitation? Pelvic rehabilitation is a non-surgical way to help your pelvic floor muscles work better. These muscles support your bladder, bowel, uterus or prostate, and sexual organs. When they are weak or uncoordinated, you might have leakage, pain, or stool passage problems such as stool leakage or chronic constipation, and pelvic rehabilitation can restore their function. Pelvic rehabilitation is supported by strong scientific evidence. Studies show it is the first-line treatment for many pelvic problems. This means it's often the safest and most effective place to start your healing journey. Who needs pelvic rehabilitation? Many people think pelvic problems are just a normal part of aging or childbirth, but they aren't. Pelvic rehabilitation can help people of all ages, from young kids to new moms to older adults. If you have been living with symptoms silently, it's never too late to seek support. Research from over 100 pelvic health clinics shows who comes for pelvic rehabilitation. Most patients have urinary problems, followed by pelvic pain and bowel issues. These numbers remind us that pelvic problems are common and you are not alone. Many people are surprised to learn how common pelvic issues actually are. Pelvic rehabilitation can help with problems in several areas of the body. For example, urinary issues like leakage, frequency, or difficulty emptying the bladder are very common in both males and females. It also helps with reproductive concerns such as pregnancy or postpartum related changes and pelvic organ prolapse. Some people come for bowel problems like fecal leakage or functional constipation. Others seek help for chronic pelvic pain or pain during sexual activities. And even children can benefit from pediatric pelvic rehabilitation. So, as you can see, pelvic rehab is for people of all ages and all stages of life. Pelvic rehabilitation is a team effort between you and your provider. Patients usually visit their gynecologist or urologist first, and then refer to me if they need pelvic rehab. We healthcare providers work together to understand your symptoms, your goals, and your lifestyle. The goal is to support your whole well-being, not just treat isolated symptoms. At your first visit, we start with a detailed conversation about your health history. We talk about your bladder, bowel, sexual pain, and surgical history, as well as your personal goals. This helps us understand the whole picture of your pelvic health before starting any treatment. Pelvic rehabilitation offers many different interventions, and each plan is personalized for the patient. One powerful tool is biofeedback. We can use ultrasound to visualize how the pelvic floor muscles move, or EMG sensors to measure muscle activities. This real-time feedback helps patients learn how to contract and relax their muscles correctly, which builds confidence and speeds up progress. We may also use dry needling to release tight trigger points in the pelvic or surrounding muscles, especially when pain or tension is a major barrier. And in some cases, we combine traditional therapy with advanced modalities like ESWT shockwave therapy to stimulate tissue healing, or HIFM, an electromagnetotherapy, to strengthen the pelvic floor muscles through intense muscle contractions. These tools are carefully chosen based on the patient's goal and condition, always aiming to help them move, function, and feel better. Let's talk about pelvic floor muscle exams. Pelvic floor muscle exams are the starting point of effective care. They help us see how your muscles are working, their strength, control, and ability to relax. This information guides your treatment plan and makes your progress measurable. External pelvic exams look at your muscles from the outside, how they move and respond to touch. Internal pelvic exams let us feel the muscles more directly, which gives the clearest information. There are different ways to check pelvic floor muscles. Basic screening can be done through closings or with ultrasound. More advanced exams like vagina or rectal assessments are only done with your consent. A full exam looks at many aspects of your muscles: strength, endurance, and coordination. We also check flexibility, relaxation, and how well they support your daily activities. This complete picture helps us design the most effective plan for you. This figure shows how pelvic floor function can change over a woman's lifetime. In panel C, we see a normal pattern. Pelvic floor strength can drop slightly after childbirth, but recovers well with proper repair. However, in panel D, you can see what happens when there is a birth-related damage without full recovery. The function dips and stays lower over time. Just like sarcopenia causes gradual muscle loss with aging, birth trauma can create an early step-like decline in pelvic floor muscle reserve. If this lower baseline isn't improved, aging will add further decline, increasing the risk of leakage, prolapse, and pelvic pain. This is why pelvic rehabilitation during pregnancy and early after childbirth is so important. It can help restore the muscles and prevent long-term problems. If you are ready to take the next step, I'm here to support you. You can scan these QR codes to visit my website, follow me on Facebook, watch more videos on YouTube, or book an appointment. Thank you for watching, and I hope this video gives you confidence to care for your pelvic health. See you next time.